know, when the holidays are upon us, we all have kind of a vision in our heads, like the inside of a snow globe. We want everybody to be happy, and we want to have healthy, perfect holidays. But in fact, the emergency room sees 30% spike every year in the patients. The patients being us. The holiday season is also the season of the emergency room. So today we've kind of assembled a dream team of medical professionals who are all here to handle what we consider the top 6 holiday hazards. Please welcome back to our show, Dr. Anish Sheth, Dr. Holly Phillips, Dr. Whitney Bowe. Holly, Anish. So Dr. Anish is a gastroenterologist, but we're going to talk today kind of about the other end, something that can make you go poop a lot. Food poisoning. Yay! 'Tis the season, kids. So, Anish.
Yes.
How many times have you had food poisoning?
Probably a handful.
Me? Dozens. You know why? Because for years, I did travel and food travel shows, and the food would sit for hours and hours.
That's a great point.
Yes, yeah. And the more you travel, guess what you get the more of? Food poisoning!
Right, and so, like, food is a big part of the holidays, right?
It is.
It is probably one of the most important things, but unfortunately it can lead to some GI distress, right? So food poisoning can be caused by viruses, but most commonly bacteria. And the most common bacteria, is salmonella. Right, so we've all heard about salmonella, but we don't often know how we get it. And you can see a picture of it right here. Salmonella is from contaminated poultry, undercooked meat. But that may not be how you get it. Sometimes people don't eat meat, and they say, how did I get salmonella? Well, it's from food preparation. So you have a nice buffet set up here. The person who prepared the food may have done everything they could, but they may not have washed their hands as well as they should have when they prepared the meat, and they're preparing salads, cheese plates. And so you can get a salmonella infection that way.
Even if you didn't wash the surface where you had the chicken with hot enough water, right?
Absolutely.
Yeah.
So bacteria salmonella loves to live between 40 and 140 degrees. So you want to either chill something or cook it more than 140 degrees to kill the bacteria. But say you've done something and you made an honest mistake and you happen to have some salmonella on your hands. You're preparing for a big holiday party.
And you're using your hands to take out the chips from the bag and to put out the crudité.
So you have it on your hands. You may obviously can't see it. And then you're going to adjust everything. You're going to put out your hors d'oeuvres, your cheese plate, your cheese board, carrots, hummus, a nice quiche here. You may be setting up the utensils,
you put the silverware in the thing.
Right. And so you're going to have this. Everything looks great. Your guests arrive. They're ready to eat.
What did they give you as your magic dust fake salmonella?
I hope it's not salmonella.
Glow in the dark. I have a special handy-dandy thing over here. I'm going to act like a detective, and you guys want to look with me and try to find it? All right, so... I think we got some here.
So it would literally be all over the table.
Can you guys see this over here?
And now food poisoning, it's not just a little bit of nausea, a little bit of vomiting, a little bit of diarrhea. If you're serving elderly...
What are the health risks of very serious food poisoning?
So number one is dehydration, especially in young kids as well as elderly individuals. Dehydration, electrolyte abnormalities, not able to keep enough fluids down. So one of the big things we want to do to correct this is make sure we're well hydrated. And we have over here some substances that we can use. Now, initially, when we have food poisoning, what's happening? We're vomiting.
Should you go to a hospital, or should you treat this at home?
So I usually tell people, if you are otherwise healthy, so you're not at extremes of age or have a lot of medical problems, if you're vomiting for 6 to 12 hours, you can probably get by at home. Once you get past the 12-hour mark, you need intravenous fluids, otherwise you're going to run the risk of dehydration. If you are vomiting, it's good to start with some ice chips here. We have a sports drink with electrolytes. We made some ice chips just to put in the mouth, get some electrolytes in the system. You can actually make your own oral rehydration solution at home. Very simply, you have a liter of water. You have a half a teaspoon of salt, right, which you can just mix in. And then you have 6 teaspoons of sugar. So sugar, salt, and water. And you can mix that up. And that's your own, basically your own sports drink.
Right.
Exactly. You can do that anywhere. Make sure the water is clean. If you are traveling in a foreign country, make sure it's boiled water.
I like the ice chips, because if you try and drink too much water too fast after you've been sick to your stomach, we all know what happens. You just keep urping all over.
And a real quick way, people often ask, how do I know I'm drinking enough water?
Right.
Urine chart we have here. So you want to be either 1, 2, or 3. That usually means either your urine is clear or it's a pale yellow. The darker you are, the more dehydrated you are.
And the worse it is for your body, obviously. Right.
Absolutely.
Okay, now we're moving on to Dr. Holly, and she's working on another food-related holiday calamity, choking.
Exactly. And unfortunately, choking increases a huge amount during the holidays.
Because people are talking while they're eating.
Exactly.
I mean, don't talk with your mouth full. Moms say that for a reason.
And they are all right. So, you know, choking happens anytime something that gets lodged in our windpipe, also called our trachea, and it just blocks the airflow, both in and out. Now, for adults, it's usually food. Again, talking while you're eating or eating too fast. For kids, especially around the holidays, they can ingest small objects. You know, holiday decorations are particularly appetizing to 2- and 3-year-olds, so you got to really keep your eye on them. Now, the universal sign for choking is this: 2 arms kind of around your neck, just showing that your airflow is cut off. But it's as important to know when not to give first aid as when to give first aid. So if you see someone doing this, but you hear them coughing rather loudly, they can make a lot of noise. They're really digging in there with their cough. They're able to clear their throat. They may be choking, but that's a good sign that they'll be able to
clear it themselves.
Right. So leave them alone and call
People that
for
are
help.
actually choking are silent, right?
Exactly.
Yeah.
So call for help.
Because the food is lodged there.
Exactly. If they're silent or they're making a high squeaky sound, we need to do some first aid. So Dr. Anish is so nice, but do you mind if I demonstrate on you?
Are you going to Heimlich him?
Maybe just a little bit. So the American Red Cross says to follow the 5-by-5 rule for first aid for choking. The first is 5 back blows. So it's violent and it sounds bad.
I can take it.
So the first thing you do is you take one hand and you put it on the patient's chest to just help to stabilize them. You ask them to bend down. Ideally, their body will be parallel with the floor. You take the heel of the other hand and deliver 5 firm blows. Not that firm, sorry, sorry, Dr. Josh. But in real life, you would really want to pound on them 5 good times. Then after that, you lift them up, find out if they're still choking. If so, we move on to the abdominal thrusts, also called the Heimlich. Abdominal thrust, there's 4 steps. First, make a fist. Second, put that fist, stand a little bit behind them and to the side. Put that fist somewhere in between their belly button and right up under the rib cage. Meet the fist with your other hand, and you're going to give 5 sharp thrusts up in an upwards motion. And those actually have to be very, very hard. Don't worry so much about hurting the person. Just worry about getting the food out.
Right.
Check, see if they're okay. If not, we go back to the back blows.
Gotcha. So 5 and 5 back and forth.
Dr.
Whitney, you're going to go on to burns?
Yes. All right, guys. Come over here to see some burns. So when it comes to burns, what causes the burn actually matters. So I want you to imagine that this cake represents your skin. And then over here, we have some food coloring. So this, you can imagine, is actually boiling water. Now, if the boiling water gets on your skin, it's going to hurt. It's going to cause a burn, right? But it's unlikely to penetrate very deeply into the skin. But now imagine that this red food coloring represents boiling oil or boiling grease. Now this, if it splashes on your skin, it's actually going to penetrate even deeper into the skin, and it's much more likely to leave you with a scar. So when you think about burns, we usually categorize them into 1st degree, 2nd degree, 3rd degree.
And 3rd degree burns.
Let's take a look at an image of what a 1st degree burn looks like. So this sort of looks or reminds me of a sunburn. It stays in the superficial layers of the skin. It's red, it's tender.
This is the one you get from the oven racks, like these.
I was going to say, Rachel,
we didn't really need a graphic for this. You could just look at Grasshopper over here from
graphic number 1, Rachel's right arm.
Right, yeah.
All right, so this is a 2nd degree burn. Okay, so 2nd degree burns, they go deeper into the skin. These are the ones that tend to blister. Everyone's saying ouch.
And then the blister breaks and just keeps falling off every time you get in the shower. It's really gross. Yeah, and they make scars more like these.
Exhibit B.
Right.
So here we have a 3rd degree burn. So you guys, if your skin looks anything like this, okay, you are calling 911. You are going to the ER. Signs of a 3rd degree burn could be a white waxy appearance. It could turn dark brown. You could get almost like a char on the surface of your skin. So what do you do if you get a burn at home? So Dr. Anish. He's like the demo guy.
I survived my choking episode, so I'm
let's
ready to go.
imagine that you have burned your arm over here. All right, so here we're going to run it under water for about 10 minutes. You want to cool the burn. You got to cool the burn. And cool water is good enough. You do not want to use an ice cube. If you use an ice cube, that
it can burn more.
Extreme temperature can actually cause more damage. And step over here into my little laboratory over here. So you want to then, once you've cooled the burn for about 10 minutes, you want to pat it dry, and then you want to apply either a thin coat of petroleum jelly, or what I like to do is I like to use aloe. I actually have an aloe plant in my house, and we use it for these kinds of things all the time. So you apply a thin layer of the aloe.
For first and second?
Yeah, first and second. And then you want to apply a non-stick dressing and paper tape. So guys, if you go to the pharmacy, you just ask for non-stick dressing and paper tape. You dress the wound, especially if it's going to rub against your clothing. Because then it can hurt. But if you do get a blister, which you just mentioned, you want to leave that blister roof intact. So guys, you do not want to pop your blister and peel off the blister roof, which everyone sort of is tempted to do, right? You don't want to do that. The blister roof actually acts like a natural Band-Aid, and it protects the burn from getting infected.
Don't take off the skin.
Don't take off your skin.
Right.
And when do you see a doctor for a burn? So if the burn is larger than 3 inches wide, if the burn is on your face, your hands, your feet, your groin, you got to see a doctor. And if the burn is over a joint, so if it's over your wrist, if it's over your elbow, you want to see a doctor. Thank you for being such a great victim here.
It's my Nicely done. Guess what? We've only done 3 of our top 6, so we got to take a break, and then we'll come back with 3 more. So we're talking about common holiday hazards because, believe it or not, every year the emergency room visits go up 30%. We have kind of a dream team of doctors. We're back with Dr. Holly. What are we talking about with you? We're up to number 4 now.
Exactly. We're talking about falling. So ER visits for falls increase dramatically during the holidays. One of the biggest culprits is falls from ladders. So if you are going to use a tall ladder to put up or to take down decorations, follow what we call the 4-by-1 rule. So if for each 4 feet that you go up on the ladder, make sure you're pulling the ladder away from the wall by 1 foot. So if you're going up 8 feet, the ladder needs to be away from the wall 2 feet. And if you're going up to 12, pull it away by 3 feet, and so on and so forth. The biggest trick, though, is to have someone hold the ladder for you. Don't try and do it by yourself. Make sure you're being stabilized. Absolutely.
Yeah. Okay, Dr. Anish is next with, well, something we all know a little something about, so alcohol-related injuries.
Right, so food and drink. This is the math portion of the program as well, Rachel. So how much should you drink? How much is too much? 1 drink an hour. But what is 1 drink? Well, 1 drink is a 12-ounce glass of beer,
or a glass of
5-ounce glass of wine, or a shot of alcohol. And the equation to figure out how much alcohol you're consuming is what's the volume of alcohol you're consuming, 12 ounces, 5 ounces, 1.5 ounces, multiplied by the amount of alcohol in that drink. Percent alcohol, which you can find on the label. And again, a glass of wine, for instance, 5 ounces times about 12% alcohol is 0.6 ounces. That's 1 drink. So 1 drink an hour. 2 tips: drink 8 ounces of water for every drink of alcohol you have.
Hydrate and dehydrate at the same time.
And eat food that slows the emptying of alcohol from the stomach. So you want to actually slow and have a steady release as opposed to hitting a spike of alcohol.
My wine glass is always filled a little higher than that one.
Like, yeah, that's
good to know.
A wine glass, Anish. Okay, Whit, bring it home.
We're on to cuts, guys. So this is probably one of the most common injuries.
Again, would you like to use my hands?
Yeah, I know, and the other side of your hands too, right? So when you get a cut, what do you want to do? So Dr. Holly, you're up. You're going to wash it under soap and water. Wash, wash, wash. And then the next thing you want to do is you got to hold firm pressure because you got to stop the bleeding. So imagine that you cut your finger. You want to hold that firm pressure, and ideally you actually want to raise this above the level of the heart because that's going to get it to stop bleeding even faster, okay? And then what I like to do is I like to apply a natural remedy. I like to apply honey. Because honey is naturally antibacterial. It's good for wound healing. But guys, you don't want to use the cute little bear that you get at the supermarket. This one has bacteria in it. You want to buy something called medical grade honey. You can get this at a pharmacy.
I did not know that even existed.
You can get this online. It's
but I was
sterile.
like, oh, good. I'll just bring this into the kitchen.
This is sterile. It's filtered, so it's safe for open cuts, okay?
I got you.
Now, when do you want to see a doctor for a cut? You want to see a doctor for a cut if your cut is longer than 3/4 of an inch, deeper than 1/4 of an inch, if it doesn't stop bleeding, or again, if it's over a joint.
All of that is great information, and I have broken every single one of those rules. Thanks, guys. You know I appreciate all three of you. Grab a healthy snack and come on back. We'll be waiting for you here.